When I was 37, I had debilitating fatigue. There was so many reasons for it, but it was just so far beyond anything that I can manage on my own. And I went to my provider, I went to my GYN, and they did basic labs and said, everything's fine. It wasn't fine. So dug a little bit deeper, I had low vitamin D. No one tests your vitamin D, right? Low vitamin D, low testosterone, low progesterone, and low T3, which is the active form of thyroid. No wonder why I was tired. But no one looked at that. So I had to do that work myself. And then I turned around and was like, oh my gosh, I feel so much better. I need to do this for other people.
Okay, so welcome to your first breakout session of the afternoon called Hormones, Muscle, and Health, Reclaiming Power and Productivity in Midlife. Now let me introduce our speaker. Dr. Nicole Smith is a board-certified nurse practitioner and certified personal trainer with over a decade of clinical experience in family and orthopedic medicine. She is founder and executive medical director of Antigravity Wellness, a telemedicine-based functional health practice focused on guiding women through perimenopause and menopause. She developed the Hormone Harmony Method, a personalized science-backed approach that combines evidence-based medicine and compassionate coaching to address symptoms like brain fog, fatigue, anxiety, and burnout. A competitive bodybuilder, author, and engaging speaker, she brings warmth, humor, and practical insights to help women reclaim energy, strength, and confidence during midlife transitions. Please help me welcome Nicole.
Hello, everyone. Today we're going to talk about something that affects every single woman in this room. None of us get to escape it. Either now or in the future, but that we rarely discuss openly in professional settings. We're talking about hormones, your hustle, and your health, and how to reclaim your power and productivity in midlife. So I'm going to show of hands who here is over the age of 35, over the age of 40. Over the age of 45, or over the age of 55.
55.
Okay. You're in good company, ladies. All right, so I see you and I hear you. And today we're going to change everything you think you know about this phase of life. So, quick medical disclaimer, education purposes only. You need to consult with your provider. I'm not going to talk specifics about like hormone replacement, but that is something that I do in my practice, and I definitely advocate for women who are going through this phase of life. Very safe for those of you who have a provider that they're working with. So if you look on your table, I let you guys put the little gifts there. One of them is this little pamphlet. This is one that I like to use a lot, and I give it to people who are trying to refer people to me, going, what did you do? If you have 3 or more symptoms, we need to talk. We can figure it in perimenopause. You're 35 years, you're going to see 3 or more of these symptoms. There's something going on there. So that's your little reference sheet there. We're going to have another freebie for you guys too towards the end. So let me paint you a picture. It's Tuesday morning, 9 a.m., and you're sitting in the boardroom for weekly leadership meeting. 6 months ago, you would have been the first to speak up, the one with innovative ideas, the person everyone looks to for decisive leadership. But today, you're sitting there thinking, what was I supposed to present on today? You walked into the room with confidence, but now you can't remember why you walked in here at all. You're exhausted, even though you went to bed at 10, it's your normal bedtime. You're irritated by the temperature. Is it hot in here or is it just me? And you're wondering if everyone else can tell that you feel like you're losing your mind. Does this resonate with anyone? So here's what's happening. We have over 50 million working women in the United States experiencing perimenopause and menopause right now. 73% of them report that their symptoms are affecting their work performance. And here's the kicker. 25% are considering leaving their careers entirely because of symptoms they don't understand and can't control, and no one is helping them. How many of you are surprised by these stats? like, I'm living it. Yes. So we're dealing with an invisible crisis here. We've got brain fog, we've got crushing fatigue, we have mood swings that come out of nowhere. Sleep that's more like a suggestion than actual rest. And the cost? We're losing productivity, we're losing talent, and women are suffering in silence. So who am I to talk to you guys about this? My name is Dr. Nicole Smith. I am a board-certified family nurse practitioner, orthopedic certified nurse practitioner. I'll be sitting for the Menopause board exam at the end of this month. Very good about that. A little bit nervous. Certified personal trainer, nutritionist, and I've worked in healthcare for over a decade. Worked actually at the hospital. Started out at Kennewick Hospital, then Trios and Catholic, and being a hospitalist, working in that system, and it was great. I loved it and got so much from it. But honestly, it was always, you think of like the string, and you keep pulling people out because they're drowning. That's what we do in the hospital. We pull drowning people out of the water. So I wanted to go more upstream and treat those people who, before they fell in. That's what preventative medicine is, and that's what functional medicine is, and that's why I developed my practice this way. When I was 37, I had debilitating fatigue. Was I stressed? Yeah. Was I working a lot? Yeah. There was so many reasons for it, but it was just so far beyond anything that I could manage on my own. And I went to my provider, I went to my GYN, and they did basic labs and said, everything's fine. It wasn't fine. It's not fine. So I sought out a naturopathic doctor who dug a little deeper. I went and did my own training. So I'm like, I'm a provider. If I can't get help, oh, everyone's screwed. Like, okay. So dug a little bit deeper. I had low vitamin D. No one tests your vitamin D, right? Low vitamin D, low testosterone, low progesterone, and low T3, which is the active form of thyroid. No wonder why I was tired. But no one looked at that. So I had to do that work myself. And when I turned around and was like, oh my gosh, I feel so much better. I need to do this for other people. And that's not what you're going to find in the traditional Western medicine model. So that's why I do things a little bit differently in my practice. So my mission is simple. I want to transform healthcare from sick care to wellness care. My passion is empowering women to reclaim their health and vitality. I specialize in functional medicine, hormone optimization, and perimenopause and menopausal care for women in Washington and Oregon State. And I telemedicine practice, which means you don't have to come to a clinic, talk to your phone, talk to your person. Makes it nice and easy. So talk about what's actually happening in your body. Who here has never heard of perimenopause? You've heard of menopause, you've never heard of perimenopause. Anybody? Good, I'm so glad. That's great. No, I love that. Because that used to be a term, like when I was going through school, I didn't know what perimenopause was. Like that was a new term. Menopause is that 12 months without a period and you're over it, right? You're not over it, but you're always going to page 32. But your symptoms can get better than they usually do. But there's this time period called perimenopause, and it can last anywhere from 2 years up to 10 years. And it can start as early as age 35. I've even met a woman who was in her 30s. And by the way, we can have a hysterectomy, partial or total, that kicks off that whole process a lot sooner. No one really talks about that though. And if you have a doctor who can tell you that, I love that, but most of them don't. A lot of people come to me and say, I have no idea. So during all that time, your estrogen and progesterone start fluctuating wildly. It's like a roller coaster. Wouldn't it be nice if it was just a gradual decline? Men have a thing called andropause, and then their testosterone gradually declines. And for the best part, not us. It gets slammed into it. Our testosterone also goes down, so we get to enjoy all of that. So think of it like a roller coaster we didn't buy a ticket for. It's not fun. One day your estrogen is high, the next day it's crashed, and progesterone is its own thing entirely. And these hormones don't just affect your reproductive system, they affect your neurotransmitters in your brain like serotonin and dopamine. So here's the domino effect. You got poor sleep, that leads to low energy, which leads to mood changes, which then leads to cognitive issues. Think like brain fog. That leads to poor performance. And it's not in your head, it's the hormones. Okay, so let's talk numbers because this is something we love data. 60% of women experiencing perimenopause report memory and concentration issues. So how many of you walked into a room and forgot when you were there? Yeah, or get in the middle of a sentence and completely lost your train of thought.
People forgot how to breathe.
80% report fatigue that's affecting their productivity. Who here used to be able to power through a 12-hour day but now feels exhausted by 2 p.m. in a 10? And then we have mood changes, anxiety and irritability that impact your leadership style. Have you noticed that things that never used to bother you all of a sudden now, like you just can't stand them?
Yes.
A lot of things read wrong. So, and then 85% experience sleep issues. This is such a huge problem, and it is such a common one that I hear in my practice. So who here, maybe even last night, was laying awake at like 3 a.m. after lunch sleep? Yeah. Every night. Yeah. And you didn't used to have that problem. It wasn't a thing, right? And let's not forget about the physical symptoms. We got the hot flashes, right, in the middle of the presentation. Joint pain that makes you feel like you're 90, right? There. Headaches that come out of nowhere. Who wants me to stop talking about that? So you're not broken, and you're not losing your mind. You're experiencing a normal biological transition that no one prepared you for, no one told you about. Our moms didn't get taught this, so they didn't know to teach us. But we're here now, and we're going to learn about it, so you can teach your daughters. Let me tell you about Sarah. Sarah is a 47-year-old CEO. She's brilliant, she's accomplished, she's used to getting results. But for 3 years, she visited 6 different doctors trying to figure out what's wrong with her. So, doctor number 1 said, you're just stressed, try yoga. Doctor number 2 said, it's normal aging, just gotta get used to it. Doctor number 3 ran some basic blood work and said everything was normal and offered her antidepressants. And clearly, these were hormonal symptoms. No one ever looked at her hormones or even said a word for menopause. Her messages to doctors went unanswered for weeks. When she did get responses, they were dismissive. She was given band-aid solutions instead of anyone actually investigating the root cause of her symptoms. How many of you feel dismissed by a healthcare provider when they're dismissing you? How many of you have been told it's all in your head or you're just stressed? This is the broken reality we're dealing with. Waiting 2 to 5 years for a proper diagnosis. 80% report being dismissed by healthcare providers. Messages are missed, delayed, or ignored entirely. And the result, women suffer in silence, believing that they're crazy. And here's what I want you to know. You're not crazy. The system is broken, but there is a better way. Do you remember Sarah? Today, she has her energy back. She leads with confidence. She sleeps through the night. She's sharper than she's been in years. What's the difference? She found a provider and a team who listened, who validated her experience, and who created a personalized plan that evolved with her needs. This is one of the missions that we have. And we've got other providers that are here today who are also on that mission of functional medicine, of driving that forward, of getting to the root causes of things. And I love that we have so many of us here that are starting to grow this community. Because there's so many of you, we cannot possibly take care of ourselves. So we need a team of people to come together and do this. So first of all, what we do, we listen. Like, listen to the woman in front of you. Your symptoms are real and valid. You're not making this up. Second, we investigate. We do the deeper dive. We go into the functional axis of what's going on. The surface level is not good enough. Third, we collaborate. You are the expert of your body. Yes, you went to medical school. We know the physiology and all that, but you are living it. So we believe the woman in front of us when she says, I'm still not feeling well. Something's wrong. Our plan of death is you change because going through perimenopause, man, I wish there was a, here you go, here's your hormones, and I'll see you in 5 years. No, it doesn't work that way. We're going to see you again in 3 months, we're going to see you in 6 months, we're going to see you in a year because things continue to change as we're going through this transition, which is very normal. And when you know that, you're prepared for it. When you don't know that, you're left in the lurch and you fall through the cracks. So this is healthcare as it should be, and it's available now. We have people here who can help you. Now let's talk about another area where women are getting terrible advice. So let's meet Lisa. Lisa is up for 5 a.m. fasted cardio. She skips breakfast because she's been told it's good for weight loss. She survives on salads during the day. No carbs. No carbs. She does a lot of HIIT classes and Pilates religiously. She's actually very disciplined. And at the end of the day, she has 3 glasses of wine because she just can't sleep any other way. Higher and higher, right? Lisa's exhausted. She's gained weight despite doing all the right things. I'm not going to call anybody out on this one. All right, her cortisol is through the roof, and she keeps trying new diet trends, ending up worse off after each one. Here's what's actually happening. That fasted cardio that's so great for the guy, not good for you. What it does, it increases your cortisol, keeps it up all day. Those solo approaches of just the cardio are not working. We're not doing our strength training. We're not building our foundation. You end up skinny fat if you are actually able to lose weight and then worse off. Skipping meals creates blood sugar chaos. Again, stressors on your meals. Eating less than 100 grams of protein a day leads to muscle loss and metabolic damage. Who here knows how much protein you need to eat per day?
I think that's a pretty good idea.
Yeah. Who wants to know what the heck a gram of protein is? No one's ever measured a gram of protein. Great. Very, very common. We didn't get taught this. And also, there's a lot of the reels and the memes out there. No, you do not need to eat 300 grams of protein a day, girls. I know it seems like a lot, but gradually increase. We're going to talk about that next on the next slide. So less than 20 grams of fiber daily creates gut health disaster. That's very common too. We're eating diets that are very processed. We're losing that fiber. It's a problem. Barely drinking any water leads to dehydration that masquerades as hunger and worsens those brain fogs and those headaches. Zero stress management skills lead to inflammation and weight gain. Here's a question I ask my girls a lot, my patients and friends and everyone. When they tell me how much they have on their plate, how much stress that they're doing, do you have 1 or 2 stress relieving techniques that you do during the day? Most of them are like, what's that? What are you talking about? I just barrel through, I survive the day, I go to bed, I get up and I do it again the next day, right? Yeah. So I'm going to teach you something on the next slide here that's going to help you with that. And then trying diet after diet leaves you worse off each time. So we need a sustainable way of feeding our bodies, not just the next diet fad. Okay. Are you starting to see what this is for? So here's the good news. Lisa figured it out. She now eats before training. She hits her protein goals every day. She strength trains 3 times a week and still enjoys her Pilates and her HIIT. She has 1 glass of wine on weekends with friends instead of every night. And she practices 10 minutes of meditation daily. The result, she's stronger, leaner, and more energetic than she's been in years. You guys want to know what she did? So here's the blueprint. First, we're going to fuel. Wake up in the morning, we're going to have half a protein shake, half a banana, or a slice of bread. Or you can do like half a cup of Greek yogurt and a 1/4 cup of berries. And work up from there. I know you're not hungry right now. A lot of girls, that's what they say. Not hungry in the morning. If I eat, I feel like I'm going to be nauseous, especially if I go work out. Gradually increase, and your body will start to rev up. Your metabolism, what that tells me when you're not hungry in the morning, it tells you your metabolism is completely better. You should be hungry in the morning. Second, we want to power up with our protein. So when aim for 1 gram per pound of ideal body weight, so what does that look like? If you use your hand, a really good way to measure, you can say the palm of your hand, fill that up with protein for each meal. That's a really good starting place. You're going to hit about 20, 25 grams, maybe 30 grams with that. And then making sure that you're having some protein with your snacks. Don't have like just a banana, have some nuts with it or something like that. Okay. Third, we want to focus on fiber. 30 grams daily for gut health and satiety, which means you're full and satiated. Plus, it is what the American Heart Association is now recommending for women who's reached 25, now it's 30, to prevent heart disease. And that's already a concern as they get older. Our risk of heart disease goes up after menopause. So these are estrogen, which is conjunctive. So So that comes from vegetables and grains and things such as that. And then you want to drink half your body weight in ounces of water per day, unless your provider tells you otherwise for medical reasons. So, and then fifth is smart training. You want to do progressive strength training and sprint interval training. I know I'm throwing a lot at you guys right now. There are guides on our website. If you go to antigravitywellness.com, there's lots of resources there. We don't have time to get into all of it here, and I want a Q&A session at the end here, so we're kind of breezing over this. So 6, alcohol awareness, really making sure that we're minimizing our alcohol consumption. A little bit is fine. There's really no studies that I can find that says 0 alcohol unless you have a pre-existing condition. But we definitely don't want to be drinking 2 to 3 glasses of wine every night. There's something else going on there, right? Okay. And then 7th is stress mastery. Incorporate 1 to 2 stress management techniques into your daily life that fit your routine. So everyone's different. So go out there, try a few out, and see if you like one of them. Okay? So who here knows what the physiologic side is? I'm gonna get to teach Boston. I'll do it first too. Okay. So we're gonna do what's called the physiologic side. We're all gonna do it together. Okay. So what we do is you breathe in through your nose, nice and deep. And then take 1 more sip at the top, and now breathe out through your mouth, nice and slow. Do that 2 more times. Breathe in through your nose. Another sip, and then breathe out through your mouth. 1 more. Okay. The room itself. That's awesome. So you can use that technique anytime, right? You can be talking, they're talking to you or at you, and you can use that technique. They don't even know. You're in traffic, you have to go up to give a presentation. Any of those times, it's a really great technique. Guided meditation is great, making sure you have a really good sleep routine so that you are sleeping well and deeply, using those face masks and those earplugs. I actually did that last night. Actually, quite a bit of a difference. I felt good this night. So, just those little tiny things. It doesn't have to be this huge lifestyle overhaul, but you take a few little things and spread it out throughout your day, and it makes a really big difference. It starts to build up and creates that snowball effect. So I know that a lot of those things that are out there for perimenopause and menopause, you got to revamp your entire lifestyle. It feels very overwhelming. Break it down. Break it down into small things. I'm going to do 1 thing this week. I got it down. Next week I'm going to add 1 more thing. And that's the thing we're trying to do here. This is not a quick fix. This is not an overnight. This is for the rest of your life, and you're going to take care of yourself. And you deserve it. You've made it this far. You've done a lot. You've had families. You've raised babies. You've made empires. And you deserve to take care of yourself now. And that way you can show up as the best version of you for the rest of your life, for yourself, and also for those people that you care about and the people that you serve. So let's talk about Jennifer. Jennifer is the VP of marketing. During board meetings, she had to excuse herself because of hot flashes. She worked from her car during lunch breaks because the office was too hot for her, but cold for everyone else. I'm just thinking, too, learn how to do that. And these are all true stories. I just changed names to kept innocent. She went to HR. They had no policies, no understanding, no solutions. She felt invisible and seriously considered early retirement. How many of you have felt invisible in your workplace when it comes to your health needs? How many of you have had to make accommodations that you felt embarrassed about? Yes. This is the costly reality that we are dealing with. There's no menopause policies or support. Temperature-controlled environments that ignore women's needs. Flexible work options that are denied or stigmatized. Mental health resources that don't address hormonal changes. Leaders who lack education about menopause impact. And the result? Talented women are leaving the workforce. Companies are losing their most experienced, wise, and capable employees. It's not okay. But here's the transformation story. Jennifer found a new company that gets it. They have flexible schedules so she can work when she's most productive. They have quiet spaces for rest when she needs them. They provide menopause education for their managers. They have temperature options and comfortable spaces. They've expanded their mental health resources to include hormonal wellness support, which is different than just your standard mental wellness support. The result? Jennifer is thriving. She's leading major initiatives. She's mentoring other women through their transitions, and the company is retaining top talent while increasing productivity. Who wants to work at this house? Sounds great. All right, so here's the transformation blueprint. Flexible scheduling, so people can work when they're most productive. Environmental support with temperature control and comfortable spaces. Education investment, manager training on menopause impact. Mental health expansion with resources addressing hormonal awareness. This even applies to men, by the way. Men with low testosterone will get diagnosed with depression. They're not depressed, they're low testosterone. Policy innovation with inclusive benefits and support systems. And culture shift. Normalize the conversation and celebrate the wisdom that comes with the experience of these women. So speaking of resources, this is a free resource that I built for you guys for this conference. So if you scan the QR code, it'll take you there. And this is what it looks like. And you can print it out. It's got a self-assessment checklist of your symptoms. It tells you what perimenopause is and the basics of that. And it even has a lab list to take with you to your doctor. That's one of the major things, most common things I get asked is, what labs do I need? Let me tell my doctor what labs I need. I'm like, yeah, you can check. And you'd be surprised, some providers will work with you and some won't. But if they won't work with you or they don't know what perimenopause is and menopause, because it takes specialized training, definitely seek out that hormone specialist to augment your care. And then on your table, you have our little pamphlet and everything. So that also has a QR code if you wanted to learn more about our services in particular. You have that available there, and that's also up there on the screen. And you have a screening questionnaire, just make sure that you're in the right place. So ladies, I want to leave you with this. Your power is not diminishing, it's transforming. Midlife isn't about managing decline, it's about optimizing your next chapter. Your hormones may be shifting, but your potential is limitless. You have the wisdom, the experience, and the strength to not just survive this transition, but to thrive through it.
I'm curious about the numbers associated with testosterone. So, like probably a lot of people here, I am in full menopause, although I'm there because of surgery. Everything yanked out, had fire sale, nothing went. So I know that our ovaries normally produce testosterone, and I know that the FDA has no approved amount of testosterone for women. So what numbers are we looking at? Because I know that doctors have said, well, we can test it, but we don't have a range it's supposed to be. Same with other hormones like estrogen and progesterone. So where are you getting the numbers for those, and what are those numbers?
It's a really good question. Interesting fact, we have more testosterone in our bodies than we do estrogen. It's just a heck of a lot less than men. So it is a human hormone, testosterone. It's not a male hormone, it's a human hormone. And it's ridiculous the FDA does not approve it because you need to restore physiologic levels like we do with estrogen and progesterone. The guidelines for that, unfortunately, don't specifically exist, so it's more through a functional medicine route and observing where women feel best. So we treat not just the numbers on the sheet, but also the woman that's in front of us. So how is she feeling? If her testosterone level is 5, she probably feels like garbage. If her testosterone level is more like 14, 15, she might feel a little bit better. Some of them might need to go even higher than that. Estrogen levels, we want to get them more up to like closer to 80, and that is backed by the Menopause Society as being protective. So she might feel better, and she's only at 40, but we get her to 80, and that would be better as far as her protection is for things like osteoporosis, Alzheimer's, or cancer cases. We have these receptors all the way through our bodies. It's not just our uterus, and it's not just our ovaries. We also make testosterone and then thereby estrogen in the adrenals. So that becomes our primary source after menopause.
So what were the units that you said? So you said for testosterone 5 might not be great, but it might be better to go
closer to about like 14, 15. It depends on the woman.
What's the units?
You know, off the top of my head, it's like IU per milliliter.
Okay.
Don't quote me on that. But pretty much all the labs, they should be in the equal units. That's a really great question, but yes.
So, I'm at the age where I probably can't have babies, but I've had an IUD. So I had one when I was 35, I had it taken out, I had another one put in. I have not had an actual cycle since I was 35. I'm gonna be 55.
So the average,
So I'm also wondering, like, they told me you have to have like a period for 12 months. And I'm thinking, do you want me to play Russian roulette with pregnancy at 55 years old?
Yeah.
And so what are the chances that I'm actually post-menopause versus, and is there a test that they can tell you, like, do to say, hey, yeah, you're good. You're not gonna get pregnant.
yeah. There's a couple things that I look at. Your age is one thing. Your age from your mom and grandma when they went through menopause can also give us a lot of information about when you were likely to go through it, although that's not 100% because environmental factors play a role.
Yeah.
And we can test what's called FSH, which is follicular hormone comes from the brain, goes to the ovaries. And when we go through menopause, that number starts kicking up because the ovaries are shutting down. So the brain goes, hey, what are you doing down there? So it like takes more signals. Yeah, wake up. So we can do a couple of those to see what's going on. But everyone's just a little bit different. So your particular situation, you gotta work with somebody who is willing to work with you on that. You might need to use condoms for a while or something when you come off that. If you come off the, yeah.
Pull and pray.
Yeah.
That's the only thing.
Yeah, we'll have other ways of, pregnancy prevention, but the likelihood is pretty low after 50. But again, if women in perimenopause get pregnant, it can happen. Just because
I know.
Yeah, just because it's lower doesn't mean that it's not there at all. So yeah, definitely something to be aware of. FSH, we want to check the serial FSH. And we have to look at, is it hormonal IUD, is it non-hormonal IUD? That's the Mirena, it's hormonal, yeah, so it's got progesterone in there. So if we were to leak, it's useless to kind of test your progesterone because it's gonna be released because of that. So we could look at your FSH, we could look at your estrogen, look at your testosterone, and see kind of what's going on there and start that process. Good question.
I was super curious, something else about vitamin D. My daughter is in her 30s, and I'm in my 50s. And she was every day, completely fatigued, having a lot of problems, and found out her vitamin D was extremely low. And then mine's normal, 50 something, but I take, her doctor's not only telling her to take 2,000 IU a couple times a week, and I take 5,000 IU with the K12 in it 5 times a week, and I'm still staying in the 50-something range. So I'm just curious what you suggest on the vitamin D amounts we should be taking and if the K12 is important.
Yes, yeah. So you guys might actually tell by your skin tone that you probably have a genetic variance where you may not be converting vitamin D quite as well. Add to the fact that we live up north.
Yeah.
We live in the Pacific Northwest, we do not get enough sunlight up here. And as we age, we stop converting that vitamin D in our skin into the active form. So typically, with pretty much all my patients, I start them on 2,000 to 4,000 international units of D3, which is the active form, every day. But that's, my patients, I've already done evaluation and everything, and I keep testing levels. So it is important if we are supplementing with things, especially vitamin D is a fat-soluble vitamin D, we don't heat it out. So it can get toxic in the body if you take too much. We should be monitoring that. So they need to have that check with their provider. And it depends on what type they're taking. Sometimes, and I've seen this, although it's really not recommended even in orthopedics, we don't use it anymore, doing D2, which is the precursor. So you can still buy that over the counter So you can take the precursor, D2, and hope your body will know what to do with it and convert it properly, but sometimes that doesn't work, so D3 is better. And that one we typically would give like just a couple times a week. But for ease, I just usually put them on every day and start at 2,000 up to 4,000, sometimes higher depending on where they are, if they're responding or not. K2 is also very important to take with it because it helps with absorption. And we need that. We need the vitamin D levels up in order to absorb calcium, which we know is important for our bones. One of the things that it is. So, yeah, very good question.
You actually answered one of my questions. I have two. So I was low on vitamin D, and I ended up overdosing on vitamin D and getting really little. And so that was just, I had no idea to do that, but that would even happen. So that was the answer, that the toxicity of vitamin D, because I wasn't sure if that was truly what made me sick, but I'm pretty sure it was. My other question is, I'm one of those lucky ones that went into perimenopause very young, and I felt like it was pretty young. And I've been on hormone replacement therapy for a long time, and I'm curious to know if your thoughts are, how long can we be on testosterone and all of the other hormones? And if it's a good idea to continue, is there a time in my life when I probably should consider stopping?
We used to think that lowest dose for shortest duration. Now we know that's not the case. So, and I've heard women say, you can take my hormones out of my dead cold hand. If you're feeling good and you're healthy and you're continuing to be monitored by a provider, forever. Like, literally forever. There's no reason to take it off.
I have a quick question, and it may be a silly one, but why do insurances put a cap on vitamin D testing when it's so important? Why do they say only every 3 years or some, I know it's different for each insurance company, but why do they do that on something that should be done yearly, right? At least?
It's a really great question. This is one of the reasons why I step back away from insurance-based care, because they tell me what I can and cannot do when they're practicing medicine without a medical license. It's really irritating. I get that all the time in the hospital. So if they say that it's not medically necessary, and we get into this problem a lot with Medicare and Medicaid patients, if they say it's not medically necessary, then they won't pay for it. And then we're faced with out-of-pocket costs, which can get very high. But with providers like myself, and other functional medicine providers that are here, we find other ways around this. So we have contracts with other groups, other labs, so we can get it so much cheaper. For example, if you go to LabCorp and you just off the street, you walk in, try and get a vitamin D level, it's gonna run you maybe $200. It's insane. I can get it for $20. So the markup on these things is crazy. And part of that is because of insurance, because of trying to get reimbursement and saying, no, we're losing money and we're raising it's a broken system, ladies. So it's very frustrating, but there are workarounds. So you absolutely can test your vitamin D level a lot more frequently. You just might have to pay a little bit out of pocket. You find a provider who has a relationship with the lab that can get you a cheaper price for that.
Yeah, well, that's what I have to do, but it's just insane to me for something that is so important to our health that we're punished. Feels like.
It feels like it should be basic, but it's not.
I was curious if there's a generic multivitamin that you would recommend for maybe those that are pre, but walking up that hill a little bit.
I do love multivitamins, and I do put my patients, pretty much everyone goes on multivitamins unless they have some type of allergy we have to be aware of. And there's several really good ones out there. Hormone makes some really good ones. I don't have an affiliation with any brands or anything. Cotage is the one I've been using a lot lately because it's fermented and seems to be really well absorbed. I tend to like it in men's version, actually really good for guys. But yeah, there's some good ones out there. And again, your functional doctor can tell you. We have lists of those that we trust. And we do have a dispensary on my website too, through Full Scripts. You can go there and there's a lot of things in there, and I have some protocols in there as well. You always want to work with your provider though, and make sure, and you always want to check the back of the bottle, because there's sometimes, like, I've had women who, they don't get along with ashwagandha, which ashwagandha is supposed to be like this nice, happy, no, like some people, they have a GI reaction to that, and that's one tiny component of this multivitamin. You take a multivitamin and you have GI distress, and you're like, oh, I can't do multivitamins, it might be actually a component in there. So there's a lot of things to be aware of, but those are kind of like the two. Cottage and Dorn are two of my favorites.
Thank you for speaking today. What's your opinion on caffeine and disruptive sleep?
I do too. So I do a weekly theme on my social media, like last week or the week before we just talked about caffeine. So caffeine can be really great, but it does push your adrenals. So if you have something wrong with your adrenals, like you're having a lot of morning fatigue, you need the caffeine to get out of bed, that's a sign we actually need to address that issue as opposed to just using caffeine to get through the day. Coffee is great, we do have caffeine, and we want to make sure that we're not drinking any caffeine past 2 o'clock at the latest. Metabolism of caffeine is 6 to 8 hours on average, but there's people who genetically, they actually take longer to metabolize it, so it actually affects them more. There's people who, like, you know, they have half a shot. I got a girlfriend who does that. She has like half a little coffee and she's like bouncing off the wall. Not handle it. And it can disrupt your sleep, even if you think that, oh, it doesn't bother me, but it can still disrupt your deep sleep, so it won't be as restorative. So, and that's a bummer, because I enjoy my afternoon coffee as well, but we need to kind of address, like, why are you so tired in the afternoon as opposed to let's push through with more caffeine.
Is tea or coffee same?
Both have anything, chocolate has caffeine. So, yeah. It definitely has less. Rude. It definitely has less caffeine, and that's to be taken into account, of course, you know. But at the same time, it still has some caffeine, so you can be aware of that.
I want to know how menopause affects diabetes, the blood sugar levels and stuff. Now we're looking at that hormones being connected to it.
That's a fantastic question. So she asked about how diabetes is affected by menopause and hormones. So super interesting, because I had a patient, one of my early patients, she was diabetic, and I was like, you're going to start hormones, is that okay? So I did a lot of research, and yes, absolutely. It actually will help. What happens when we go through perimenopause and menopause is our insulin resistance goes down. Estrogen, that freaking hormone, it does so many things. And one of the things it does is actually improves your insulin sensitivity. So when we start to lose our estrogen, our insulin sensitivity starts to go down with it. If we also have diabetes on top of that, complicates that whole situation. But they've done studies now, thankfully, and they're showing it's very safe for diabetics and actually can help their insulin or their anti-diabetic medication work better. So it is definitely something that should be in collaboration and should be treated, not disregarded there.
Okay, sorry, I want to make sure other people can ask questions. I'm wondering, because when I expressed my concern about this to my doctor looked at me like I had two heads. What are your thoughts or your understandings of the effect of menopause or perimenopause and what's the bad cholesterol, the bad cholesterol?
We have LDL, we have
HDL is probably.
Cholesterol and the loss of estrogen or just hormones in general. Because I've noticed that my tests have gone from being pretty good, and all of a sudden hysterectomy, bam, through the roof. Ooh, you need to change how you're eating. I'm eating the same.
Yeah. Yes, and so what's going on there? Again, loss of estrogen. Estrogen is anti-inflammatory in the blood vessels. So when we lose that, they start to get more hard, and that's also that increased risk for heart disease and stroke. is that loss of estrogen. So when we lose that, we start to see those effects of that inflammation. The effects of higher cholesterol, higher LDL, or low density lousy is another way to think of it. That increases your risk, and then they're like, oh, we need to throw you on a statin medication. It's like, well, maybe not, and also don't blame the woman for her eating habits because they haven't changed. Obviously, that's not necessarily the cause. Yeah, so going through that transition is definitely affect those levels.
So I'm reading these symptoms right here, or triggers. How do you tell the difference, or if you've been on medication for more than half of your life and some of the side effects cause these type of symptoms, would you have to go off the medication to realize if you were in premenopause or menopausing?
Yeah, so that's complicated, and that would take a provider to sit down with you, go through your full history, your medications, and your side effects, and what could be going on, and what's in the labs. Like, it can get really complicated, and that's why, like, with general primary care provider, we need time to do that kind of deep dive. So finding a professional provider that can really go deep with you and figure all that out is what I would recommend. Is there a question about your how on that?
So I have a question, I guess. So with somebody that's, for instance, on the Mirena, like I've been on it for a year, but it was just in the last 3 months that my doctor mentioned perimenopause. If that is in fact what I'm going through, is it recommended to not have the Mirena or to stay on it, or how does that?
It's a really good question. I have some people that are like that, and so we can get deep dive into the research and what that says. You can absolutely still treat you going through that transition, and you can keep your IUD. Because it can be protective. And we need, like, so you have a uterus, if we give you estrogen, you need to take progesterone in order to protect the uterus. You already got it on board. So you're good there. We can absolutely give you estrogen on top of that. You're having symptoms like hot flashes, and sneezing, night sweats, and all that good stuff. That's some people right there. So we can absolutely combine that. We can put you on testosterone, that's not a problem. That's actually one of the things that we can use through that transition is to place a like Mirena IUD if we're having issues with like bleeding and things like that. That's a really great way to help with that. So yeah, you're covered there.
If you're unable to take hormone replacement therapy, other medical issues, are there non-conventional options?
Yes, yes. So there's a lot of options that we have. There's, the herbals that we can use, but there's also FDA-approved medications, things like SSRIs and things like that we can use to treat hot flashes and things of that nature, sleep disturbances that are non-hormonal. So yes, very safe to use. Also, for a lot of women, even if they can't do oral or topical, like a patch type of hormone replacement, they can still, and again, everyone's different in situation, but most of them can still use like vaginal estrogen, and I talked about this before. Those two do not cross over. So vaginal estrogen treats the genitourinary system, treats the vagina, treats the uterus if you still have it, and treats the bladder. It doesn't cross into the circulation though. And it's very important that we're using that. I think honestly it should be a little counter. Advocate that because it's so very safe, and every single woman is going to have some level of things going around down there. So when we replace the estrogen, it improves the elasticity, it decreases pain, it decreases your risk of UTIs, and it doesn't cross over, it doesn't increase your risk for any kind of cancer or anything like that. So that's something that can be very safe. Again, with your provider, we're doing that. It is by prescription only. Currently. Yes.
I just wondered, I have had a couple ultrasounds on each breast, and when I would talk to the gal doing the imaging, I had kind of mentioned that sometimes I feel like a feeling, and I can't really describe it any better than that. And after the radiologist looked at everything and he came in and said everything looked good, it was explained to me that those, what appears to be feelings that you can feel apparently quite often, it can be, you're feeling the hormones leaving your body. And I just wondered if that was really true. Because I thought that was odd that I would have never, I've never felt any sensations before. And it just, that was the response I received. He was male. I don't know if that matters.
That's very suspect.
I would have to kind of talk to you a little bit more about the feeling that you're having specifically, but in general, you can see from that sheet there, thank you, that we have, and that's not even a comprehensive list, by the way. There are so many symptoms that we can have as our estrogen and all that is starting to decline, and we do feel it. And that's, that's that whole, like, we feel like we're going crazy. You're not going crazy. We really are experiencing these hormonal changes, and it's the cougar menopause, right? You guys heard that? So it is that change that we're going through, and it's a transition. We definitely feel that as things are getting rewired. So, yeah. Yeah. Yes.
Going around with like hormones and stuff, I saw it sometimes with dry. Can you explain like why you go through that?
Okay. Isn't that random? Dry eye, yeah, it can be a symptom. Itchy ears, again, because I know, right? So weird. But again, we have estrogen receptors throughout our entire body. It's not just an ovary and uterine and breast hormone. It affects the entire system. So we can absolutely have those symptoms such as dry eye, itchy ears, or just like some random stuff. You wouldn't think it would be it. Palpitations can be another one too. Oh yeah, yeah. You can have basically like a late, kind of like perimenopause. A late perimenopause symptom where your testosterone actually kind of like has a last hurrah. And in relation to your estrogen, in relation to your estrogen and progesterone, now it's high, and you're starting to have like those tumor hairs that are showing up, and things like that. It can definitely happen. So fun. All right, guys. I think we're out of time.